Hey everyone, it's Dr. Steve here. Before we get started, just want to give a shout and let everyone know to check out pausefourukraine.org. This is a movement that we put together to support the pets and the people, the veterinary community, and pet parents in Ukraine. It's a charity movement, and we'll be looking to help fellow human beings out and to do the right thing there. Should be a QR code that pops up on the screen. If you guys are interested, please point your camera at that, and the rest should go from there. If you can't do that, just go to pausefourukraine.org. Have a read, and please support if it's something that you're interested in supporting. So once again, I'm Dr. Steve Weinrauch. I am a veterinarian. I'm the Chief Veterinary Officer at Trupanion. I'm also the founder of MightyVet. And today we're going to be hosting basically we'll call it an office hours, because we have a couple of professors here. We'll introduce you to them right now. We have Professor Scott Weiss. Scott, if you can give a quick wave. Scott's also a veterinarian. He's a boarded specialist in internal medicine. He's at the Ontario Veterinary College, and he's the director of the Center of Public Health and Zoonoses at the University of Guelph. For those who don't know, zoonosis is a fancy term meaning things that can be passed between pets and people. We also have Professor Mike Lappin. Mike, give a wave. And Mike's also a veterinarian and a boarded specialist in internal medicine. He's at the Colorado State University of Veterinary Medicine, and he's the director of the Center of Companion Animal Studies at CSU and the chair of the World Small Animal Veterinary Association One Health Committee. So just as a housekeeping note, please throw your COVID-related questions into our social media chats. We're live on a whole bunch of different platforms right now. We'll do the best we can to answer questions. We're going to go ahead and ignore political questions and questions that have nothing to do with COVID and pets today. So this is not a political discussion. This is not about personal beliefs. This is a great place to ask questions about COVID and pets. Why are we doing this? We're doing this because we have hundreds and hundreds and hundreds of thousands of members that reach out to us on a daily basis, not only at Trupanion, but in veterinary practice, where people ask all sorts of questions, worried about their family pets, worried about themselves. And we really want to bring the experts today together to simply have a conversation about those questions and ease some fears and talk about what's next, where we've been, what we got right, what we got wrong, and all those fun things. So thanks again for joining us, and we'll take it away from there. And I think why don't we start with to the professors? What do you guys think we got right the first time around?
Well, I'd say, I'd say we got some stuff right. We got some stuff right eventually. I think we got a lot of things right. We took a little longer to get there than we should have. If we're thinking the animal side, I think that's very true. It's a bit of a mixed bag. And we got some good communication, some good research on the animals, some good surveillance, but it was pulling some groups, by the teeth to try to get them to pay attention. So we eventually did learn a lot. I think from the veterinary profession, we did a lot of things right by being able to provide, the same level of care to animals despite massive interferences, restrictions, changes, and everything else. So that might be my two initial points.
Yeah, and I think we got some things right as well. Certainly regional. We had some really amazing people pulling together with things like the Center for Disease Control and the AVMA here, plus the shelters coming together. And that's the American Veterinary Medical Association. Everybody pulling together to take the small amount of information we have about the risk to animals and then potential risk from animals back to man. I think regionally we did quite well in many parts of the world. And then in others, we might have had a little bit of a significant lag with maybe some significant animal fears that might have led to some short-term, oh gosh, handling the animals perhaps inappropriately, as you probably read on social media. But it didn't take long, and even that got corrected in most countries around the world, where we ultimately realized the pet was not going to be probably too much of a danger to the next human, and so the animals were treated appropriately. So it's good to see it come pretty quickly.
Yeah, it's interesting. I think we did the first ever worldwide COVID council, and it was maybe February or March a couple of years ago now. And it seems like we're a whole lot more informed now than we were before. I think we did a pretty decent job, all things considered. But what did we get wrong? What did we get wrong across the board?
Well, I think we were just slow in recognizing the One Health aspects. We talk about One Health, which is that intersection between human health, animal health, and environmental health. And one of the problems is we talk and we don't act a lot because it's a complex area. And I think we show that here. And you mentioned CDC doing a really good job, and I say that they did a good job eventually, because we went through rates from CDC, WHO, various groups saying, okay, there's no evidence that animals can be infected. Well, no one had looked, right? We got lucky to some degree that there's not a big role of most animal species. But I think it was just one more reminder that we were slow on thinking about the animal component. We were slow on thinking about the role of animals in people's lives. It comes back to something that Mike said about how some animals were concerns about being abandoned or abused or neglected. We knew all these things, but we just didn't put them into action. So thinking about animals' potential role in this pandemic, thinking about the impacts of animals for what we're doing to people, trying to prevent human disease and how it spills over, how we investigate some of these issues. So eventually we came around to it, but I think it just showed again that we don't talk and we don't act as well as we like to think we do.
Yeah, no, I don't disagree, Scott. Those are really great comments. It always definitely could have been faster. I was a little bit saddened by the fact that we didn't get the word out quite as quickly for a number of things that we learned over time, because there is still a lot of, kind of false information running around even now, over 2 years into the pandemic, especially with the fear of animals and potentially a four-legged animal causing infection of the next person. I mean, we still have some of the kind of cruelty type worries in some countries. I think hamsters were in a bad way there for a while. So it really is important that we keep attempting to get accurate information around the world. And that's where, for the veterinary side of things from One Health, it's nice to have an organization like WSAVA, the World Small Animal Veterinary Association, because we do reach 116 different countries and or associations. But then it also has to get from their delegates to their members. And of course, we get all sorts of conflicting information as well, because we're just, a loosely aligned group, just one of many. So like Scott said, I think being more coordinated in passing on accurate information would be great for the next pandemic.
Mike, are there any countries out of all those groups that just did an exceptional stand-up job, or are we all kind of in the same boat?
Yeah, I think we're all pretty much in the same boat. Certainly the countries that you would expect that do a lot of One Health things already, the UK, the most of all of Western Europe. But we were kind of flying by the seat of our pants, right? No matter where you're at. I mean, Scott, basically ran the world of Canada when it came to this particular organism and jumping back and forth between animals. So kudos to, I'm going to give it to Scott. I'm glad he's here today, because his group was one great leader that we all followed as we got started with trying to become more coordinated.
Yeah, that's great. Thanks. So way back when I was in vet school, we learned a lot about viruses and concerns that something would be happening in the next 100 years. And we learned about swine flu and avian influenza and all these other things. COVID wasn't. I must have missed the class on that one. It was an unknown, or it was unknown to me. Does this surprise you guys that it was COVID versus avian influenza versus a swine flu or some other animal as a mixing vessel?
Yeah, I guess I don't get too surprised by infectious diseases anymore. I think, when we've paid all attention to things like H5N1 avian flu, which always is a big topic, I think we've said, yeah, that's a big deal. But the thing is probably not the thing that's going to come and bite you in the butt. It's the thing you don't know about. I've used SARS as an example of this on the animal side, the original SARS virus, and that we knew it could infect cats, we knew it could infect ferrets. We kind of got lucky maybe that it didn't spread more widely in animals and it just kind of died out in people. So I think we've realized that there's a lot out there. It's been estimated there's something like 1.7 million undiscovered viruses, however you figure that out. But even if like .something% of those are a potential concern, like that's still a lot of viruses that are out there. So we pay attention to avian flu. The known things we have a little better ability to respond to, because we don't have to start at ground zero with tests and treatments and vaccine technology and everything else. So we're always going to have a better chance. And the known things have also been around for a while, right? If something's been around for 50 years and it hasn't blown up in our faces, it's probably less likely to blow up in our faces than something that just makes it into us right now, like this virus did.
Yeah, and I think this one was really a bit of a surprise because SARS-CoV-1, as Scott mentioned, was managed pretty quickly or went away on its own a little more quickly, perhaps not as contagious as the first variants of SARS-CoV-2. But I don't think really any of us were thinking there was going to be another SARS pandemic. I think most of us, at least in our public health group, would be looking at the influenza viruses, right? Waiting for the next jump from the avian group, those influenza A's. And so to have this virus and then to have legs, it really, it's like, oh, well, this will go away in 2 or 3 months, like they were able to control SARS-CoV-1, and then MERS, that Middle Eastern variant as well, kind of went away pretty quickly. So it's exciting what might be happening in the future.
So on to that. That's a question that we got from the audience is, and this is challenging. I mean, every day in practice, my entire career, people wouldn't say, look into your crystal ball, Dr. Steve, but that's what they meant. They'd say, what's going to happen next? And that's such a hard question, even in day-to-day practice, let alone in virology. But using your imaginary crystal balls and being very educated on this, what are you guys looking at in the future? What are your thoughts on what may or may not happen here? We'll call them educated guesses.
Keep going first. Do you want to take this one, Mike?
I'll let you have that one, Scott.
Well, I'm going to be the doom and gloom guy here, and I'm really not. But it's been said we're in the pandemic era because a lot of things are coming to head that make pandemics more likely. Climate change changes ranges of mosquitoes and changes how we interact with animals. Urban expansion, we're encountering critters, environments we never have before. Armed conflict, displacing animals, displacing human populations, migration. There are all these things that come together to change how we interact with nature and how we interact with animals. And that's where these viruses are coming from. We're talking viruses because that's mainly the risk, but that's where all these organisms are coming from. And like 100 years ago, we were probably seeing pandemic potential viruses jump into people, every once in a while at least. But what's the difference between 100 years ago? Well, if you were in the middle of nowhere 100 years ago and you got a really nasty virus, you're probably going to die or get better and not spread it any further than maybe your family or your local village. Now you can be on a plane and be anywhere in the world in 24 hours. So we've got lots of things coming together right now that create a situation where there's greater chance to encounter other things. There's greater chance to spread them. There are a lot more people around to help spread things once they get established. So we have to realize that you can't just say, okay, this is a 1 in 100 year pandemic, right? We had Spanish flu in the early 1900s, we had COVID in the early 2000s, and we're good because none of us are going to be alive for the next one. So it might be 100 years or 500 years, or it might be next Tuesday when the next virus comes out, which is just a reason we need to pay attention to, why this happened, like the whole post-mortem of what could we have done better, right? And I think that comes back to the start is what did we do well, what did we screw up, and how do we do more of the first and less of the second next time through.
Yeah, no, those are great points. And I think that we're still kind of in the sorting through what happened, right? To learn from it, to what are we going to do better next time. I think since if we're really talking from the four-legged animal side of things, then we dodged a bullet so far with the variants that we've seen of this particular virus, just because the small companion animal has not had a variant that led to significant death losses or illness to this point. But that doesn't mean that the next variant wouldn't potentially have that capability. So I think learning hospital preparedness and things, especially on the veterinary side, since that's what Scott and I do for a living, getting our hospitals where they can be a safe place to continue to provide care for those animals. And then the added excitement of being a virus that can go from four-legged to two-legged. And so potentially if the right variant arise. So, but it's impossible to predict, right?
Yeah, it totally makes sense. It leads perfectly actually into another one of our members' questions. Again, this is how it started, with members not knowing where to look for the right information, and certainly don't want to be doom and gloom. That's not what this is about. But we need to be realistic. In veterinary medicine, we see things, and One Health, we see things, and there's a connection there. So what scares you at this point? I guess we can, that can be about anything, but really specifically from our members' perspective, what scares you with pets? What scares you with COVID? Or maybe it's not COVID. Maybe you're more fearful of avian influenza.
I think when it comes to pets, neither one of those really scares me. Because, avian, the good thing about our pet species is they're not as susceptible to a lot of the things that we're talking about in the pandemic, because they don't encounter that many individuals. We know dogs and cats are susceptible to this virus, but they're what we call dead end, right? Not that they die, but it goes into them and the virus dies out, because we don't keep thousands of dogs together on a farm. We don't have thousands of animals out, dogs in the wild, or cats in the wild, like we do deer, which is a big concern for variants. So what they get is from us. So what we do to prevent things happening in us protects them. The biggest thing we can do to protect our animals is to control this virus in us and vaccinate and do everything else to control transmission. So for those two things, I'm not too concerned about the animal side. For the animal side, it's just, are we going to get more animal diseases, right? This was a virus that came out and affected people, really likes people, and a lot of other species. We have new viruses that could be out there that could infect dogs or could infect cats. It's harder for a pandemic like that to happen because, again, cat to cat transmission is a lot harder than person to person to person. But it's still a concern. But I don't stay up night worrying about pandemic level diseases in animals. I worry about the routine things that we deal with, because that's where most of the illness and death is. And we can intervene a lot better with better healthcare, better vaccination, the whole things that we do to optimize animal health. And that's really what we need to focus on. It's just the day-to-day routine things. That's the best impact we're going to have.
Yeah, and I agree 100%. I have currently 5 cats and 4 dogs at the house, and I love them like you wouldn't believe. And so it has not been a big concern to our family, this particular virus, just because of after getting a few months in, knowing what the experimental studies were showing, mild illness, et cetera, at worst. And then with a number of variants spreading quickly around the world in the preferred host, human, we still haven't seen many consequences in the small companion animals. So I'm not worried too much about that. But it is great to get that worldwide message around, though, because we still have animals dying of our regulars, canine distemper virus, canine parvovirus, feline panleukopenia, all of those viruses, which are much worse for dogs and cats, still take their lives all around the world just because we don't get vaccines into all. And then you look at rabies. I mean, gosh, the rabies issue in some countries is still quite horrifying, animal-associated rabies.
So let's talk about that. Go right into vaccinations, because I'm still hearing from our veterinary community every single day, if not multiple times a day, people are still asking, should we be vaccinating our pets for COVID? They hear about coronavirus. They have some understanding about cats and coronavirus, et cetera. But let's speak. I know we've spoken in previous COVID councils about that, but let's speak again definitively, unless something that I don't know about has changed. How do you answer those clients that come in every single day about should I vaccinate my cat or my dog for COVID?
Yeah, Scott, I bet you and I haven't changed our answer at all since the last time we talked about those things, right?
Yeah, probably not. Like my line is, I'm glad we have the vaccines, but I don't want to use them. I'm glad that they're like Mike said, we don't have a variant that's come in and causing serious disease. If it happens, great, we've got a vaccine that would hopefully work on it. Like the longer-winded answer is, I'm going to think about vaccination for this virus in animals. I think about 4 main reasons to do it. One is to prevent serious disease, but early serious disease, because if they just get a little bit of a cough, it doesn't matter that much, and we just don't see much serious disease at all. The other is to prevent transmission to other animals. Indoor, outdoor cats maybe as a bridge from people to wildlife, but that's a bit of a niche thing. Like prevention of transmission between animal groups, so we don't keep them like mink, right? Mink vaccination, because you get thousands on a farm and they spread it around. And the other is to protect us by preventing them from making variants. But again, we don't have that rapid circulation because we don't have big populations of dogs living together that keep spreading it, and the virus changes. And the vaccines you have, really, they're designed to prevent severe disease. They aren't designed to prevent transmission anyway with our animal vaccine. So it's good we have them. I hope we don't ever have to use them.
Yeah. No, they've been quite important for endangered species and things, housed in crowded environments like the wildlife parks and zoos and things. But for our domestic pet, companion animal pets, for those 4 major categories, I think most of us that are interested in prevention and making guidelines around the world agree with exactly what Scott just said.
So we got a follow-up question from someone on Facebook here. It says, I'm interested in hearing exposure to service animals versus pets as they're out in the public all of the time, more now with people without masks and in community spaces. Either of you guys have a specific comment on that?
Well, I did quite a bit with service animals, and really I'm not concerned about that type of situation for a couple of reasons. One is the dog's not very susceptible. Most service animals don't have a lot of contact with people. They're in close confines with people sometimes. But what are we worried about the service animal getting infected for? Well, we're worried about it getting sick, but dogs rarely get sick, right? So we're worried about the animal getting infected and infecting someone else, and they rarely are able to transmit if they can. And realistically, if the person who's got the service dog, they're at greater risk from getting it from wherever the dog got exposed from. So if they're in a subway and the dog gets exposed, the person who's with the dog is greater risk of getting it from that subway encounter than the chance the dog gets infected, and a really low chance the dog's infectious. So this is why we use common sense around service animals, right? We try to limit contact of the general population with them. We try to make sure they're healthy so they don't have the greatest chance to pick up things like this and get sick. But it's not something that I'm overly concerned about.
Yeah, and neither are we here, especially since many service animals are canids or canine, like Scott mentioned. They're not as permissive a host as a cat or a hamster. And so it's really, well, gosh, if you look at some of the experimental studies, even though that PCR stuff we always talk about, amplifying the nucleic acids off the mucous membranes and surfaces and things. Well, that doesn't actually mean the organism's alive. And so some of the experimental work in dogs, they were actually not able to even grow the virus off dogs that were infected, after just a day or two. And so it's just very unlikely that the dog's going to get sick. It's going to be very unlikely the dog's going to give it to another dog, and certainly not back to the handler. So it's still trying to avoid hanging around with our friends too much, especially if they're clinically ill. Two-legged friends.
Thanks, guys. And from a Trupanion data perspective as well, we haven't seen anything change as far as claims coming in for pets that have signs that might be correlated with COVID. So since the beginning, it's been relatively flat. Well, we haven't dug into service animals specifically. If there was a blip, we would see that.
Yeah, Scott, and Steve, I'm glad you brought that up, Steve, because that was one of the things we've been complimentary about. Some of the things we've been lucky with is groups of people providing data that might be helpful. And it's probably good that the audience knows that our specialty groups, especially in the United States and Western Europe, we do have these groups of specialists that talk by email, the classic listserv that we all do in social media, but we do that amongst specialists as well. And So we've been following things like just that one United Kingdom variant that caused some heart disease, in dogs and cats. Nice little paper came out last year. Is that happening, elsewhere? And that's where our social media and sharing opinions and findings is really important. And good news, we haven't seen anything on the cardiology listserv. Scott and I are both internists, and it's been pretty quiet, animal-associated disease in the internal medicine world as well. So great news on sharing those informations.
Awesome. So another question from the audience here. Are we still in times of uncertainty, or should we, all of us are sick of this, no doubt. All of us have had enough of it, want it to go away, want everything to be better and want to be comfortable. I'm sure some people, there's a whole spectrum of thought processes on this. I just want to go outside and breathe and go places and be comfortable and not feel like the sky is falling. I don't want that, but I also don't want to become complacent to the point where we end up back where we were. So are we still in a time of uncertainty here?
Oh, I think we are, and we're going to be for a while. People like just because we want it to be done doesn't mean the virus cares. And it's not something that just disappears. It's not going to ride off in the sunset in a couple of months. It's going to become an endemic virus, with this background virus. It's going to take years. It's going to wax and wane. I'm not trying to be a doom and gloom guy. It's just a matter of, it's just going to, we'll get more vaccination. We'll hopefully get some, better vaccines over time. We'll learn more about this virus. We'll have more treatments, but it's going to take years of these cycles where it's kind of working its way down. Like winters are cold and flu season, right? And winters are going to be cold, flu, and COVID season for a little while. Doesn't mean we're going to have the same issues that we have right now with, really healthcare capacity being stretched. The big wild card is variants, right? Because the more this virus is transmitting around, the more variants can emerge. And we still have a good chunk of the planet that's not been vaccinated. So there's a lot of transmission, let alone all the transmission that's happening in areas that have vaccines but don't have really kind of high vaccine coverage. So the next variant, might emerge right now. It might not be a big deal. Maybe Omicron is as good as it gets for the virus. It's a really transmissible virus. It's about as bad as you can get in terms of virus being able to spread. So maybe it's maxed out, but we don't know. And the only way we're going to know is when we see what happens in the future. And that's why we just try to do basic stuff, right? That's why we say common sense, stay home if you're sick. We still have a lot of masking where I am. I know masks are political, but using all the non-pharmaceutical interventions, all the common sense hygiene things that we can do, and that will help keep things at bay as this sorts out. That's kind of my approach to it. So it's not over, but it's not, I think we've learned a lot and we're moving in a good direction.
Yeah, and I really think it was an eye-opening experience. I'm certainly sorry so much for the death and destruction that's come from this. But if you just think about how many people have said, "Oh, and I didn't get a cold all last year," it just really emphasizes things that we've been saying for years to lessen cold and flu season. Just hand washing, disinfectant, staying away from sick people. Don't stay as close together for a longer period of time. They're all going to benefit us in the long run, and then hopefully we won't have a next variant that is as pathogenic as some of the earlier strains.
Follow-up question to this then. So when does this become endemic? How is that defined for Joe Public out there, and frankly for most of the veterinarians out there as well? What is the definition of endemic, but how do we get to that point where everyone agrees that this is endemic?
I don't think we will. I think the definition of endemic is a bit of a floating. Endemic is basically a virus is out there in this background noise and it's always there. It waxes and wanes a little bit just based on normal biology, like colds, right? We know we have cold season. When you do behavioral changes that make it more likely to transmit, you see more disease. When you do other things, it goes down, but it's still kind of out there in nature at that standard level. And this virus isn't there yet because we see outbreaks still. You see groups that are susceptible and you'll get big peaks. And then internationally, we still have a lot of areas where you're seeing peaks at different times. So for it to be endemic, it's got to get, instead of doing this, It's got to do a little more of this, and the ups have to be things that make sense, right? They're up because this happened and that makes sense, and then it came down because we did this and that makes sense. So it's heading there, but some of the modeling says you're really not going to get to an endemic stage for a few years, because you still take time to get the population protected and know how to handle the virus and things like that. But there are lots of definitions for what people want to think is endemic.
That's helpful. Thank you. We got another question from Facebook here. How many dogs have died? Do we know? I'll throw cats in there too. It just says dogs, but I'll throw cats. How many dogs or cats, dogs and cats, have died? The data had been available in different places, but since has been harder to find. Is there a place where this information is now stored, where there's a trusted source, basically?
Yeah, I can. Yeah, either one of us can. Yeah, so still in the United States, the APHIS site. So if you type in on Google APHIS and SARS, you'll come to the dog and cat dashboard, which shows all the proven cases of dog and cat associated in other species as well. And then the World Organization for Animals, OIE. So if you type in OIE, dog, cat, SARS, that site will pop up where all worldwide cases are tracked. But of course, those are the ones that are well documented by a follow-up confirmation test. So there are many animals that have been infected and potentially diseased that don't make it to those sites. But all in all, I'm running a biosecurity program here at Colorado State and interacting with the county and the state, of course, mainly from the keeping our people safe side of things. There's not been a known associated death in the state of Colorado in a domestic pet, small companion animal, to my knowledge. Scott's been doing a lot of monitoring stuff as well. Have you guys been tracking the animals that died because of SARS?
Well, that's the challenge, right? The because of versus with. In our work looking at households where people have COVID, dogs, 40% or so will get infected. And usually you won't know anything about it. Cats are even higher than that. So if you've got that high of infection rate and this much COVID in people, you got a lot of positive animals. So you're going to test dogs that get hit by cars and they'll be positive. Dogs that have disease X, Y, and Z that will be positive. And unless you do a necropsy, an autopsy, where they look at the tissues and see if the virus is in those tissues and the virus is doing stuff in those tissues that would cause disease, you can't say whether it's because of or with, and we just don't get that much testing done. Most people don't do that for their animals when they've died. So I say we have little information on that. But when you've looked at groups of animals, and this has been done a few times by different people, you take a group of animals that have died and they've been positive. When you actually look at details of those cases, most often they died of something else. They had a heart disease, a heart defect. It was just, that dog happened to die, the cat happened to die, and their owner was sick at the same time. So they got tested because it was, something weird's going on here because the owner was sick and the dog just died. Well, the dog died of something completely unrelated. So my guess is it's, weird things happen. You got millions of dogs that are exposed, even though they're not very susceptible. I wouldn't dismiss that some have died, right? We do see some illness, but vast majority don't get sick at all. And we just don't have any good numbers.
Yeah, and then it's going to be variant dependent, right? If a variant like the early UK variant causing a inflammation of the heart, that's a big deal, right? And so it's quite easy to die of inflammation of the heart, but that hasn't really shown up with Omicron and some of the other variants that we've seen. So again, if it stays with just a respiratory illness and they don't have underlying respiratory disease that would make them predisposed just like a human, then hopefully odds will continue to stay low.
I think it's a really interesting point to drive home, Scott, as you were saying, what a pet or person may have actually died of. If someone has cancer and they get hit by a car, they didn't die of cancer. If someone has a cold or a flu or COVID and get shot, they didn't die of any of those things. So it's really important to differentiate. A lot of pets may have been infected by people and really had no impact on their life whatsoever. So yeah, fascinating. What are we seeing in the current wave? Specific to pets, how's the current wave impacting pets and we'll throw in wildlife here because I think that's the wild card. That's where it gets a bit more interesting.
Yeah, for pets, it's no different, or like Mike said, it's probably better for them because they just doesn't have that lower airway, that lung tropism. The virus doesn't like to go there as much. Wildlife are the wild card. And, you know, we've got concerns about deer is probably the biggest issue. Now, there are a variety of wildlife species that are susceptible. And what we're worried about is wildlife that are susceptible to the virus, that can spread it, and that also live in large numbers in populations where they hang out together so they can keep spreading. What we're worried about is that animal to animal to animal to animal transmission. So you make a new variant, or you're a reservoir, so that if we control this in people, they kick it back into us, kind of like flu. Deer are a big concern because they check all those boxes. Some species of mice might check all those boxes. There are a few different animals that do, but deer are the one where we know in the US, there are a lot of deer that are infected, impressively high rates that are infected. In Canada, we're finding infected deer too. And just recently has been found a variant in deer that seems to be a true animal variant, and was found in a person too. Now, it hasn't taken off in people, which is good, but it kind of shows that if it gets into animals and spreads around, this may have been in deer, may have been in mink where this thing came from. But we got a new strain in deer and at least one jump into people. So that's still a concern. Right now, though, animals are very small issue here because, yeah, there's circulation in wildlife and there's maybe variant creation in wildlife, but there's a ton more going on in people. So controlling in people is still the bigger issue right now, but the animal side actually gets more relevant as the pandemic wanes. So as we get less transmission in people, as you get more people protected through vaccination, you get less risk of variants emerging in people. If we got a ton of animals that are infected, then they become, you know, proportionally more important. And that's why we don't want to get it out there, or we want to understand what those risks are for them if it is there now.
So follow-up question to that from the audience. If I'm just trying to translate it a little bit. If somebody, if this is a respiratory thing, and we're worried about getting this from close contact with deer as at petting zoos, let's say, what if somebody has deer for meat, and it's a food animal? Is that a concern that a hunted deer could potentially be a problem, or it's not a concern because they're not breathing on the pet, or the pet's not breathing on them? Not a pet. The deer is not breathing on them.
Might be for a second. All right. So the issue is really around the time the deer has been shot. The virus doesn't like living outside. Like Mike said, you can find the nucleic acids, the bits of the virus on surfaces, but not probably the live virus. So what we're concerned about hunting is, you know, you've got a wounded deer and it's breathing hard and someone's around it. That's a big aerosol risk. Beyond that, you've got people handling respiratory secretion. So they're touching around the deer's face or its lungs. If they're field dressing it, and then they touch their face. That's what we're concerned about. Venison shouldn't be a risk. The virus shouldn't be on the meat. The virus would die if you got contamination of respiratory secretions on the meat fairly quickly, and you kill it when you cook it. We're really not worried about the meat. We're worried about that initial handling of the animal and its respiratory secretions. And there is guidance out there for hunters on how to act around deer. And some of it's there for other diseases already. It's just kind of ramping that up a little bit.
Thank you. Another question that we got. Let me just pull this up here. Biggest concern is what we need to do across the board holistically as an industry, as a pet loving population. What are we seeing in shelters with pets being returned? There were all sorts of concerns early on with shelters. I think we've done a relatively good job of going virtual out of those things. But people have adopted pets when they were staying at home. And for better or for worse, we're constantly with those pets. And then with people starting to filter back to work, are we seeing an uptick in shelters with pets? Are we seeing an uptick in anxiety cases in the university setting and in private practice as well? Behavioral issues where people might be relinquishing their pets. Is there something to be concerned about there? What are you guys personally seeing?
Well, I can speak real quickly to that. We run the shelter program here at CSU, my group, and another 2 faculty members. And so we spend a lot of time. We have shelter rounds, monthly and all those types of things. And we actually have not seen an uptick of dogs being returned to the shelter as things have lightened up a little bit. Most of our counties in Colorado have dropped their mask mandates and things. People are going back to work in person, but most of those animals have stuck. They became a family member and have not been relinquished. We know that probably differs around the country, but it isn't just a given that COVID's quieted down a little bit, so they're going to be packed to the gills with pets. The separation anxiety and things like that, because of all of a sudden an animal that you were with pretty much 24 hours a day, now you're going away. Certainly those issues definitely exist. But good news is working directly with your veterinarian, we have many management strategies, both behaviorally and natural things like probiotics and things that can help you through that. So I would just encourage non-veterinary listeners to get a chat in with their vets. We can help through those crises.
I know there's probably more than a handful of cats that just say, "Stop looking at us, go away, go back to work." But sorry, Scott, I jumped in there. Go ahead.
Well, I'd say my experience is the same. I'm not hearing that from the shelters I work with. We're still at shelters bringing in lots of dogs because they don't have large numbers in them.
And what haven't we covered? What do you guys want to put out there or talk about that we haven't discussed in this conversation yet?
I think one of the main messages that I wanted to get out is still, if you're personally ill, then it is really kind to others to just sequester at least away from others within 6 feet for greater than 15 minutes, if nothing else. And so we do need to think about that. It's a problem that we have with workers. You want to go back to work, and we do sometimes max out our sick leave time. We might not have any more COVID time, depending on what country you work in. And so people have will come back to work while ill. And that's been one of the things that I think has saved us most is trying to lessen contact with others and this virus, your pets as well, while you are potentially ill. And so I just would love for people to keep that in mind. Protect others, protect your pets if you currently have clinical signs.
Yeah, I think that culture of presenteeism we keep talking about, hopefully we're fixing that. And I think from the animal side, it's just to remember that the line between people and animals is an artificial one that we create. Right? We're an animal species, and we're no different than them in a lot of ways. And we need to realize that this ecosystem that we keep stressing, which is our planet, is going to come back and bite us in the butt because we're doing this, and that's going to hurt us. That could hurt our livestock, could hurt our domestic animals, and just reinforces the need for us to think about the broader issues. And that's, how do we treat our animals? How do we treat other animals? How do we treat the planet? Because that'll help us prevent this next problem, or prevent it from getting as bad as this one was.
Thanks, guys. So I think we've hit most of the questions that we can. Apologies to anyone across the social media world if we didn't get to your questions, but hopefully this was helpful to a bunch of people out there. I know it's always helpful to me, and thank you to both of our esteemed professors and colleagues here as well. We're going to pop up the pauseforukraine.org QR code again for those that are interested. Please go on there. Please donate. It is a 501c3 registered charity, and let's do everything we can for other humans across the world. As you heard in this webinar today, times of war, displacing people, displacing pets, it affects us all. We are one global community, so let's do what we can to help everyone out. Thank you guys for your support. Appreciate your joining us today, and feel free to share this with friends, colleagues, anyone who's interested, families. This will be posted in its recorded session on social media as well. So thanks, guys, for your time. Really appreciate it. Great to see you again, and have a great week.